So you can see my slide now.
Yeah, everything is fine. We'll start now. नमस्कार, श्री खुशहाल दास यूनिवर्सिटी के स्पोर्ट्स वेब सीरीज़ में मैं आपका अभिनंदन करता हूं। श्री खुशहाल दास यूनिवर्सिटी का ये प्रयास रहता है कि हर स्ट्रीम ऑफ एजुकेशन में हम ज्ञान का प्रचार और प्रसार हर माध्यम से करें। इसी के तहत आज हमने जो वेबिनार आयोजित किया है उसमें डॉक्टर वंदना तनवर हैं, जो कि फिजियोथेरेपी के क्षेत्र में काफ़ी अनुभवी हैं और स्पोर्ट्स फिजियोथेरेपी में उन्होंने काफ़ी काम किया है। भारतीय शूटिंग टीम, टेबल टेनिस टीम, एथलेटिक्स टीम, टेनिस की टीम, ताइक्वांडो की टीम के साथ, जो कि एशियन गेम्स, ओलंपिक्स और कॉमनवेल्थ गेम्स की तैयारी करते हैं, उनका इन्होंने सहयोग किया है और उनकी तैयारी में उन वो रही हैं, संभागी रही हैं। और उन सबका ये प्रयास रहता है ट्रेनिंग के टाइम में कि सबसे पहले तो इंजरी का प्रिवेंशन किया जाए, इंजरी की रोक की जाए। तो मैं डॉक्टर वंदना तनवर से अब आग्रह करूंगा कि वो अपना प्रेजेंटेशन शुरू करें। डॉक्टर वंदना।
A very warm good afternoon to all of you. I'm really thankful to the Shri Kushal Das University and the professor over there and Mr. S.S. Roy, which is a renowned sports entity itself. And he has always been, as you can say, a motivator for all of us, who has always tried to help us and motivate us in the sports development and giving more towards the sports development. So today we have chosen a topic which is basically sports injury and its prevention. We all understand that sports injury is a part of any sports, but now in this competitive world, it is very important to know the ways that how you can actually prevent it. So I, from Physiolution, which is my the poem A Revolution in Physical Therapy and Sports Injury, and I myself, Dr. Vandana, would like to speak about the topic which is sports injuries and its prevention. So, when we talk about the sports injury, we must know that as there are different sports, so we have different sports person, and everybody differs from their individuality, specificity, progression, the overload methods, adaptation, reversibility, and recovery. So these are the basic principles of training where the coaches usually train their players. Like they always try to give the specific training to their players, that what kind of fitness is required and what kind of particular muscles must be used. So when we talk about the injuries, it can be due to intrinsic abnormalities, which is inside the muscles or the joint mobility or any malformation inside the overloaded joint, or it can be extrinsic, maybe due to equipments or the the side by side the climatic conditions or anything it can be, or either it can be due to sports imposed deficiencies. So when we talk about the intrinsic abnormalities, it can be due to malalignment of your own body parts, joint instability, imbalance of muscle strength, weakness of muscles, inflexibility, or the rapid growth. And when, like the example, if I'll give you, you just take your foot morphology. You must have seen that the players have a excessive arch or the less arch. I mean to say the flat foot or the cavus foot. So that also leads to lot of deficiencies, which impacts your whole biomechanics. So it's very important to relate with those biomechanical errors when you actually train your athletes and when you talk about the prevention. And the extrinsic abnormalities includes the training errors, your equipments, your technical errors, or the environmental factors. So let's take that if we talk about the muscle overuse injury, which is commonly seen in most of the sports, that is a muscular strain, which is you can say a day-to-day stress over the joint, which can be due to prolonged trainings, weakness, opposing muscles, and you can see this kind of the injury cycle which is due to the overloaded. You can see here that due to muscular weakness, what happens is that your joints become weak, you have some biomechanical movements, then it becomes overloaded, and there how you will get some micro tears or the macro tears, which we really need to rule out on the day to day basis on the recovery methods. Otherwise your athlete will be injured, and he will not, his body will not respond for the next day training. So apart from the training pass, a recovery method has to be a part of sports injury prevention. We can see the common overuse injuries here: the bone, tendons, muscle, cartilage, joints. So here I have listed very common injuries, which is a ligamentous injuries, which is mostly seen in the hockey players, footballers, tennis players. So these are the basic normal injuries, which is a part of their daily trainings if their muscles are really not conditioned and they really can't take the overload which is being given by the coaches during the training periods. Shoulder injuries, so this is mostly seen in the tennis, the racket sport, and the gymnastics. So here we now decide that if the injuries are part of any sports, then what actually we need to do. So we need to basically emphasize more on the warm up. If your body is warmed up, yes, then you can prevent your injuries. If you really stretch your body in a proper way, because only the well designed warm up will maximize your performance. How? First of all, it will really improve your physiological response to the exercise, and it will also improve your psychological focus. So, when we talk about the common issues such as tissue density, tissue length, flexibility, and mobility at the beginning of the training sessions, then we reinforce the fact that movement quality and injury preventions are really essential to achieve the athletic and wellness goal. So, I believe that by doing the proper warm up, dynamic stretches, the neuromuscular activation drills, our athlete can really improve on their performance and reduce the injury risk as well. So here I will give you an example. This is the basketball player, the team. And tissue density, if we talk about tissue density, means like when we really stretch the muscles very at the very specific area. Suppose the hamstring muscle I take. So you can make use of some foam rollers. You can really stretch the lower leg, your IT bands, your spine. So it gives you the tissue release, which pull up the good nutrients and the oxygen to the muscle, and it really prevents the chances of injuries. And same with the stretching, you can work on the length of your muscles. The stretching always done, it should be done, the dynamic stretching should be a part of any sports when you really start your training sessions. Then we talk about the tissue neuromuscular readiness, which really includes some mobility drills, quick movements. So that is a part of a sample part of my warm up, which I designed here, and it has already been researched according to the International Journal of Science and Research that dynamic stretches always improve the your joint position sense, increase the oxygen uptake, and it also lowers the lactate concentration. So hamstrings, the bigger muscles like hamstring, calf muscles group plays a very important role in your agility function. For example, in tennis player. So we need to have a combination of both static and dynamic stretches of our muscles before starting up our new training sessions. So, what is the right way? What is the right way of doing the your moves to prevent the sport injury? Which can include, you can see the lunges, your sprinting hamstring stretches, your calf stretches, quadricep stretch, your half kneeling movements, your hip flexor stretches, shoulder capsule stretches, and of course the chest, the upper body stretches, which includes your shoulder stretches. So here I have shown that what is the right way of doing the stretches and your other mobility drills and the techniques of doing the squatting, because if you won't do the warm up in a proper posture, then definitely it is not going to help you in your prevention of injuries, but it will definitely overload your joint. So you can see how this player, they're doing the squat. So this is the right way of squat, where you can see your hip flexors and the knee alignment is just at the 90-degree, and your spine is erect and your neck is straight. So this is the wrong method what these two girls are doing, but this is the right posture of doing the squats. Similarly, with the lunges, lunges should be done in this position. I can show you. This is the position where this is your body alignment. Because I have seen that many players says that yes, we do the warm up, we do stretches, but still we are prone to injuries. So I want to give a message to such athletes that just doing the 10 minutes warm up, 10 minutes stretches will really won't help you. You really need to develop a technique, the correct technique of doing the warm up and stretches. This is another stretch, which is a hamstring stretch. So you can see your body should not lean down. You can make use of some therabands, which helps in the your spine is straight, and it helps in doing the proper way of stretches. And this is the calf stretches. You can make use of some other tools like the Swiss ball, the medicine balls. You must get the therabands, medicine ball, the Swiss ball to make your warm up, the foam rollers to make your warm up and stretches easier. This is a quadricep stretch, the way you should do the quadricep stretch and your hip muscle stretch. So this is the right way. You can see the posture. So, any exercise should follow the three stages, what we have concluded, which is the warm up, then comes your main activity, it means your training session, and then cool down phase, it means the recovery phase. So, the cool down is very, very important after any training sessions, which includes the static stretches, which helps in reducing the soreness, stiffness. It pull ups the good blood and the nutrients towards your muscles, remove the lactic acid, and thereby lowering your pulse and giving you the recovery and a good heart rate. So we must have the recovery after any training sessions. So, how your performance will come up? It is just not doing the warm up stretches, but yes, the recovery part. So, you have to recover your body just after your training sessions, which involves various methods. You can see, like when we start the session, our muscles get fatigued, and slowly we develop the threshold, and then the lactic acid develops. So we need to recover our body just after training session, so that our performance should not decline. Just like when the coaches give you the overloaded training, the circuit training, any kind of trainings, if your muscles won't be recovered fully, then the next day overload your muscle won't be able to take, which leads to severe injuries. So here I have shown that yes, what is the principle? Why we need to recover our body? Because athletes needs time to adapt to the training. So whenever coach gives you any training session, your body should adapt. Your body should be used to of it, and then it increases the load over your joint, and then your performance comes. So this is the overload principle, when your body is stressed, fatigued, and then recovers, and again it is re-stressed. So you need to be fresh every time whenever you are being given the next training load. So this will be done only with the quick recovery methods, like which includes your sleep quality, what is your resting heart rate. You should monitor your heart rates, you should monitor your body weights. So it includes lot of things. And if you really want to know that yes, how would I know that my body is responding to the recovery methods or not, so you can see that what are the sign of the non adaptation, which is a sudden drop in your body weight. You can see if it is less than 3%, that yes, you are not able to recover, you are not able to sleep, you are feeling constantly tired, very low sleep quality, you have sleep disturbance, and you're not able to respond to the relaxation techniques, so that means your body is not fully recovered. You really should give time to your body to recover before going to the training sessions. So your performance always come with the recovery, with the rest and regeneration, which includes the rest, sleep, your good nutrition level, your psychological unloading, your some massage techniques, the trigger points release therapy, stretching, hydrotherapy, and the active rest. So, active and passive rest both are different. Active rest means like you can do some recreational activities like pool sessions, your cross training, visualization, stretching. And the passive rest comes with the some deep massage therapy which you can take on the weekly basis, meditation, reading, listening to your favorite music. So this is how your passive rest methods, which really brings recovery to your body. So here we have already discussed that we need to stretch our body, which is included in both in warm up and even the post training. So stretching is important. You're in your warm up part and the post training sessions. So you really need to stretch your body. You need to go for the various methods of recovery, which is hydrotherapy. It is very famous therapy which we must have seen in the hockey players. Like just after training sessions, we ask them to go inside the ice bar just for say 7 to 10 minutes, so that their whatever the toxins and the injuries, some bruises has developed, they will just go away. So it has to be instant. The hydrotherapy is an instant, which we give the ice bath to our players. You can see here, it's a quick method of recovering from the injuries. So these are the methods what we physio usually use to help our athletes to recover from their injuries, and the sleep, which I've already discussed, and so stress. So if we talk about the stress, yes, stress is good also for your performance, but the stress has should not be more than that it really decline your performance. So to reduce the stress level, you really need to regenerate your body with the recovery methods. Take a good sleep, take a good nutrition, and you need to take care of your fluid, your water intake, which is really important because you really need to drink, eat, move, stretch, give the hot and cold shower after your exercise sessions. That really helps in prevention of your injuries after the high intensity training. So this is the nutritional slide which I have shown, that which includes a lot of veggies and fruits, which is very very essential to prevent the injuries. You need to have a good vitamin C, iron, vitamin A, calcium, and fatty acids in your body, so that you can take up those high intensity sessions with your full energy and then give your 100% performance. So this is another kind of meditation, which is a part of recovery to help in the prevention of injuries, which is the visualization and the breathing techniques, which is basically you can say the relaxation method for your mental peace after the rigorous training sessions. So, if I sum up that what is the road of recovery? So you can just note down that weekly microcycles should include the recovery, which includes the rehydrating, the stretching, hydrotherapy, your massage, fluid and the fuel replacement, relaxation, and the psychologically recovering. It means the switch off from your intensity training session. Just give peace to your mind, relax, and then prepare for the next day training sessions. So this is the strategies which athletes should follow on the daily, weekly, and they should plan their day. You know that what is your heart rate, what is your present body weight, what kind of sleep you're getting, how much balanced diet you're taking, are you using recovery methods or not, are you taking a proper massage therapy for your relaxation of your body, Are you planning your activities for the further tournaments or not? So these are the plannings which really helps in streamlining your competitions, your training methods, and helps you in regaining your performance and your strength. So here I sum up the my slides, which was all about the sports injuries and prevention. And remember, the winner always train and losers complain. Thank you so much.
डॉक्टर वंदना, एक चीज़ आपसे पूछनी थी। ये तो जो आपने बताया बेसिकली प्रिवेंशन का था, जो कि डाइट है और सब कुछ है। लेकिन अगर किसी को इंजरी किसी प्लेयर को हो जाए, उसके बाद रिहैब का प्रोसेस क्या होगा? वो कब से खेलना शुरू करे? क्योंकि हम देखते हैं कि ज़्यादातर एक इंजरी के बाद प्लेयर जल्दी लौटना चाहता है और फिर से दोबारा इंजर्ड हो जाता है। तो उसके बारे में आप कुछ हमें बताएं।
Sir, जब you're talking about the injury, now the post injury, now
या
the athlete is injured. जब एथलीट
या
एक इंजर्ड हो गया है, तो उसको ये सबसे ज्यादा कंसर्न रहती है कि मैं कितनी जल्दी रिकवर करूंगा। तो उसमें हम क्या करते हैं, अपनी फिजियोथेरेपी रिहैबिलिटेशन पार्ट यूज करते हैं, जिसमें पेन मैनेजमेंट, जिसमें स्वेलिंग है, टिश्यू स्वेलिंग है, पेन है, या कोई लिगामेंटस इंजरी है, तो उसमें हम उनकी बेसिकली स्ट्रेंथ ऑफ मसल पे काम करते हैं। तो जैसे जैसे वीक वाइज हम स्ट्रेंथ कंडीशनिंग रिहैब प्रोटोकॉल डेवलप करते हैं, जिसमें उनका बहुत सारी मूवमेंट्स होती हैं, बहुत सारे पार्ट्स, पीएनएफ ड्रिल्स कराते हैं, पीएनएफ स्ट्रेचेस कराते हैं, जिससे उनकी अर्ली रिकवरी हो और वो जल्दी से जल्दी अपने ग्राउंड लेवल पे पहुंच सके। और आइस थेरेपी इज वेरी इंपॉर्टेंट कंपोनेंट फॉर एनी इंजरी। कभी भी कोई भी इंजरी हो एथलीट को, उन्होंने हमेशा सबसे पहले आइस थेरेपी ही लेनी है 24 घंटे के अंदर। उसके बाद ही रिहैबिलिटेशन प्रोटोकॉल डेवलप किया जाता है। और जितना आपकी बॉडी कंडीशन होगी, जितने आपको बायोमैकेनिकल एरर्स कम होंगे, उतनी ही इंजरीज भी कम होगी। लेकिन अगर कॉन्टैक्ट स्पोर्ट्स हैं, तो डेफिनेटली इंजरीज आर गोइंग टू हैपन, एंड विच विल इंक्लूड द स्ट्रेंथ एंड कंडीशनिंग पार्ट ऑफ द muscles and the joints after the injury.
What are the very fundamental rehab facility? I mean, rehab techniques that we use? Because in towns we have, हर शहरों में तो बहुत सारा इक्विपमेंट होता है। आपके पास लैब में भी बहुत सारे इक्विपमेंट होंगे। तो लेकिन अगर जहाँ इक्विपमेंट नहीं है ग्राउंड लेवल पे, वहाँ पे कैसे रिहैब का क्या मीन्स हो सकता है?
Sir, we can, as I have shown, that we should have a foam roller with us. We should have therabands. We should have medicine balls. We should have dumbbells at the ground only. जहाँ पे आपको किसी जिम में भी लेके जाने की जरूरत नहीं है अपने एथलीट को। आप एंड्योरेंस ग्राउंड पे ही करा सकते हो, आप उनकी स्ट्रेचिंग ग्राउंड पे ही करा सकते हो, और पेन मैनेजमेंट भी ग्राउंड पर ही हो सकता है, अगर आपके पास कुछ क्विक टूल्स हैं। जैसे कि हम अपने पास यही सब थेराबैंड्स, फॉर्म रोलर्स, आइस बाथ्स, क्विक आइस स्प्रेज, ये सब रखते हैं। टेप्स, काइनेसियो टेप्स, विच आर काइनेसियो एंड रिजिड एंड्योरा टेप्स, ये सब हमारे क्विक मेथड्स होते हैं कि हम ग्राउंड लेवल पे ही अपने प्लेयर को वहीं पे क्विक पेन मैनेजमेंट देके उसको ठीक किया जा सकता है। और अगर ज्यादा इंजरीज है, अगर लिगामेंटस इंजरीज है, स्प्रेन है, तो उनको देन वी नीड टू टेक द फॉर द फर्दर इंजरी मैनेजमेंट एट दी सेंटर, where we need to give them rest also for few days, because rest is very important after any acute injury to recover
Is
fast.
Yeah, is there any difference in the rehab processes for a boy and a girl?
No, no, there is no as such difference between the men or women, but yes, it always depends on the extent of the injury. Up to
Extent of
what
injury.
extent,
Yeah,
yes, up to
yeah.
what extent the injury has happened, whether the meniscus has only been just included, or just you can say the only the instability has come, or if there is any fracture. But yes, if it is a case of fracture and if your bone density is not good, especially in women, if the bone density is not good in a women athlete, the female athlete, then definitely it affects their recovery from the fracture.
How does a women athlete balance the bone density, or gets it
With the
well?
good calcium supplements, you must have
Mm.
seen that the gymnastic, because they have a lot of landing movements, so they get shin split like this. So I have seen on the ground that how quickly they are developing the shin split just because of the lack of the vitamin D and calcium in their body. So you really need to understand your sports, which kind of
Yeah.
sports you are playing and what kind of the impact of the equipments are giving. The floor exercises in gymnastic players, you can see, It is so
Hmm.
tough. The somersaults they are doing, they're really getting the impact from the ground reactions over there directly over their joint. So if they have a deficiency of vitamin D and calcium, then definitely even the coach cannot help them. The coach is there to just to train them, but the body deficiency has to come up from their own eating pattern, their own backgrounds, that what they eat. So that is very crucial. The
Yes.
nutritional
Okay.
part.
So, thank you very much, Dr. Vandana. We had a very informative and knowledgeable interaction with you. आपका प्रेजेंटेशन बहुत ही ज्ञानवर्धक था और जिन्होंने सुना होगा उनके लिए ये बहुत ही बेनिफिशियल होगा। और मुझे ऐसा लगता है कि यही अंत नहीं है, क्योंकि 30 मिनट के टाइम में जितना हो सकता है उतना आपको जानकारी दी गई है। लेकिन सबसे बड़ी बात क्या है कि हर किसी को, कोई भी अगर कोच है, कोई भी ट्रेनर है, फिजिकल एजुकेशन ट्रेनर है जो स्कूल्स में बच्चों को कराता है, तो हर उम्र के साथ साथ जो ट्रेनिंग है, हर उम्र के साथ साथ जो इंटेंसिटी है, जो प्रेशर है ट्रेनिंग का, जो मसल्स का बिल्डअप है बच्चों का, वो सबका अलग है। जो आप 6 से 10 साल का करा सकते हैं, वो आप 14 से 16 साल को कराएंगे तो उनके लिए हल्का होगा। और अगर उल्टा कहेंगे तो 6 से 11 साल वाले को अगर आप सीनियर्स का कराएंगे वर्कआउट, या सबको एक साथ करा देंगे, तो जो बच्चे हैं उनको इंजरी होगी, जो बड़े हैं उनको, उनसे उनके लिए ठीक होगा। तो ये सब चीज़ें जो हैं खाली जो एक यूनिफॉर्मिटी ऑफ एक्सरसाइज के जैसे हम देखते हैं कम्युनिटीज़ में होता है कि एक यूनिफॉर्म एक्सरसाइज है, कोच आया, ट्रेनर आया, उसने एक तरह से एक्सरसाइज शुरू कराई, तो वो सब ही इंजरी का कॉज है। और
So,
अब
sir,
धीरे धीरे
here I would like to add
जी
something
जी
that
जी,
we need to go for the assessment, the
या
muscle
एब्सोल्युटली,
assessment, foot assessment, which I always
जी
talk about, that the foot assessment is very, very important. If you have
जी
a flat feet, then definitely the runners, endurance athletes will definitely have a
जी
problem in their joints if they have a flat feet. So
जी
we
जी
need to give them the corrected insole so that the gravity impact should get lower down and they
जी
can give the maximum potential.
जी। तो यही यही बात मैं कह रहा था कि अ, सिर्फ ट्रेनिंग कराने से, सिर्फ 4 चक्कर दौड़ा देने से और वही सिमिलर एक्सरसाइज कराने से, क्योंकि बहुत और चीज़ें हैं जो इम्पैक्ट करती हैं सेफ्टी के लिए। और अब जैसे जैसे अवेयरनेस आ रहा है, हर कुछ हो रहा है, तो पब्लिक हेल्थ में एक मेजर कंपोनेंट ये होना चाहिए जो इंजरी प्रिवेंशन का होना चाहिए। पब्लिक हेल्थ में बहुत सारे पार्क्स बन रहे हैं, बहुत सारे ओपन एयर जिम्स लग रहे हैं, हर तरफ जहाँ भी जाता है हम लोग यही देखते हैं आजकल। लेकिन वो जो पार्क्स में और ओपन एयर जिम्स वगैरह लग रहे हैं, उसमें बिल्कुल ही अनगाइडेड सी ट्रेनिंग होती है। तो पब्लिक हेल्थ के लिए अगर हम कर रहे हैं कि जिम होगा ओपन एयर और उसमें सारे कर सकेंगे, तो उसमें सेफ्टी मेजर्स भी होना चाहिए, क्योंकि सबसे ज़्यादा यूथ और एडोलेसेंट यूथ जो है उसमें इंजरीज होती हैं स्पोर्ट्स रिलेटेड, क्योंकि वही लोग स्पोर्ट्स में भागीदार होते हैं। और ज़्यादातर इंजरी जो है एक्सीडेंट से हो, एक तो एक्सीडेंट से होती हैं, वो तो अलग चीज़ है, लेकिन बाकी हर कुछ जो है वो स्पोर्ट्स से होता है। या कोई जिम लोग जाते हैं, वहाँ पे ओवर एक्सरसाइज है या रॉन्ग एक्सरसाइज है, वो करके इंजर्ड होते हैं, जिनकी वजह से बहुत यंग लोगों को मैंने देखा है जिन्होंने, जिसका लेफ्ट हैंड, राइट हैंड, बैक, कुछ ना कुछ गलत हो गया है, क्योंकि हम लोगों ने ओवर यूज़ कर दिया है जिम के एक्सरसाइजेज वगैरह
Yes,
को।
because sir,
जी
athletes को हमें educate करना होगा कि
जी
when you have to stop.
जी
They think, okay, I have a pain, let me train, otherwise coach मुझे टीम से निकाल देगा.
जी जी जी।
So this
नहीं,
this kind
वो
of
तो
phobia
जी
is also there, among
जी
the
जी
athletes, that
जी
I will be away from my team
जी
if I will take rest. But let me tell all the athletes who is listening to us that if you won't give the rest, your performance will never improve. Rather, you will
एंड
injure yourself at the multiple joints.
या ट्रू। और दूसरा ये भी है, जो कैजुअल लोग करते हैं, जिम्स वगैरह जाते हैं, जो बहुत सारे लोग हैं ज़रूरत से ज़्यादा भागते हैं, उन लोगों के लिए भी इंजरी जो है बहुत जल्दी आ जाती है, और फिर वो एक हैंडीकैप सा हो जाता है सारी ज़िंदगी के लिए। तो काफ़ी सारी जानकारी डॉक्टर वंदना ने दी। Thank you very much for being with us, Dr. Vandana, and I think in times to come we'll have a bigger discussion with you on this. So thank you very much, and we will now close. Thanks. Bye.
Thank you, sir. Thank you. Thanks to all of you.